Good afternoon, everyone. Today's session is going to be really helpful and it's led by Dr. Vimla. She's going to talk about bleeding during pregnancy. So stick around until the end and ask us questions if you have any. Let's not keep you waiting any longer. Doctor, you have the stage.
Thank you. Thank you so much. And good afternoon, everyone. Myself, Dr. Vimla CH. At Apollo Cradle, Brookfield. I am the senior consultant, obstetrician, and gynecologist. Today, I'm going to talk about bleeding during pregnancy. This is a very, very important topic which every pregnant woman should know. First thing, don't panic when there is bleeding during pregnancy, but immediately contact your doctor. Why? Because there are certain conditions which are normal having bleeding during pregnancy. Mostly we call it not bleeding, spotting. Spotting is nothing but few drops of blood. It can be a black or brown or mild red or pink color, but it is only minimal drops will be seen. If spotting is seen, it is usually a normal sign, but don't hesitate to call your doctor for whatever it is because we have to rule out some certain abnormal or serious underlying conditions also. And many women, like 20% of the pregnant women, can have bleeding during pregnancy. Not in all cases that there is some abnormality, but if we are seeing at the earliest, we can do the scan, we can see what the problem is. And those who are having bleeding during pregnancy, don't get worried because 90% of the bleeding during pregnancy with good heartbeat and those which are immediately managed, they can progress into a healthy pregnancy and healthy delivery as well. Now, bleeding during the first trimester. Like I told you all, first trimester bleeding is more common and it is seen in 20% of the women. Most commonly, the first trimester bleedings go into a healthy pregnancy. And if there is spotting or bleeding in the early pregnancy, there can be implantation bleeding as well. Implantation bleeding means where the fertilized egg comes and gets settled down inside the lining of the uterus. This usually happens 6 to 12 days after the conception, and this is usually considered to be a normal one. Many of the pregnant women miss this implantation bleeding, thinking that they are having their normal periods, which is very less. When they come to us, then we do the pregnancy test and then they get to know that they are pregnant. They actually think that they are having their natural periods. These implantation bleeding can be like very mild or it can be severe. Depends on the condition of the pregnant woman. If it is a large one, that means implantation bleeding means where the fertilized egg comes and gets settled down inside the lining of the uterus. This usually happens 6 to 12 days after the conception. Yes. Yeah. And the second important cause for bleeding during pregnancy is subchorionic hemorrhage or subchorionic hematoma. It is collection of the blood. That means bleeding from the membranes surrounding the embryo inside the uterus. This is seen in 1 in 4 women, and these subchorionic hemorrhages the prognosis depends on whether it is a small one or a large one. If it is a small, that means the size of the subchorionic hemorrhage is less than 20% of the gestational sac. Usually it will progress into a normal healthy pregnancy by means of certain precautions. But if it is a large one, that means occupying more than 50% of the size of the gestational sac, then it can even cause miscarriages. These subchorionic hemorrhages can be severe and usually
Yes, ma'am. You can start. Your
Yeah.
initial.
Hi everyone. I think there was some disturbance with the network. So now the other causes of bleeding during pregnancy are ectopic pregnancy. Ectopic pregnancy means the fertilized egg, instead of coming and settling inside the lining of the uterus, it gets increased and grow in size in the outside the uterus, especially the fallopian tube. That is called as ectopic pregnancy. In ectopic pregnancy, it is very, very important to rule out at the earliest. If it is ruled out at the earliest, that means if when we do an ultrasound and we see that the sac is still small and the beta hcg is still less, and there is no embryo formed inside and the heartbeat is also not formed inside the sac, then there is a chance that we can give you injections so that it will go into spontaneous abortion in case of ectopic pregnancy. But in ectopic pregnancy, sometimes the sac keeps on increasing in size and it starts even to burst. In those cases, immediate surgical intervention by arranging some blood transfusion also has to be done. These people usually present in the first trimester with severe pain abdomen, especially located towards the right or the left iliac fossa. That means the lower part of the abdomen, either towards the right or the left side. And they even have lightheadedness and spotting or bleeding baby. In these, when we have done the scan early and we have ruled it out early, it will be easy for us to save the tube. Otherwise, most of the time it goes into rupture if it is delayed, and then we have to remove the tube by means of surgical procedure. Ectopic pregnancies can be known even through beta hcg blood test. When we are doing beta hcg blood test two times 48 hours apart, if the beta hcg which is seen at the first time is doubled after 48 hours, then it goes into healthy pregnancy. If instead of doubling it increases but very slow rising is seen, then usually points out towards the ectopic pregnancy. If it is instead of increasing, it is decreasing, then it goes into miscarriages. Now, what is the other cause of bleeding during pregnancy in the first trimester, which is miscarriage? Not only through scan, we can also know through beta HCG, like I have told you now. And this miscarriage, the women usually comes with lower abdomen pain and bleeding, but sometimes she might come with severe pain, abdomen cramps, and passing of tissue per vagina. When it comes to that stage, usually it goes off into spontaneous and complete miscarriage. Then it will not be easy for the doctor to save the baby. And miscarriages are usually considered to be a natural way of removing the unhealthy pregnancies. Sometimes there's a term called threatened miscarriage. Threatened miscarriage means the women have pain abdomen or backache with, she might have even spotting or bleeding in the pregnancy. But when she comes to us and we do a scan, the baby will be healthy inside and the cervix is closed. For them, we give all the medications necessary and we do the surgical procedure and
So, guys, it seems like doctor's network is kind of having some issues. So, we'll end the session right now. Sorry for the inconvenience caused. Thank you so much. Bye. Take care.